Perfect. All right. And we're back to We Good, the COVID-19 virtual town hall brought to you by the African American Leadership Forum. Today's edition, we're focused on the Black family, and I am your host, Brittany L. Wright. Before we get started and I introduce our panelists, I want to say a special thank you to all of the people who came together to make this virtual town hall possible. The Minneapolis Foundation, NorthPoint Health and Wellness, Children's Minnesota, as well as our partners, including NorthPoint and Children's, Insight News, the Minnesota Spokesman Recorder, and Minnesota Community Care. As I mentioned, today's virtual town hall is focused on the Black family, and we're actually going to be hyper-focused on one family who all contracted COVID-19, and we're going to talk about how they're healing and what we can do as a community to make sure that we protect our immediate family as well as our chosen family, even those of us in Black Greek letter organizations, as well as our extended family within the community. So first, we have our panelist, Miss Adriene Thornton, who is a nurse and infection preventionist at Children's Minnesota. Welcome back, Adriene. Always glad to have you. Also joining us is Dr. Simon Ndely, who is a pediatric specialist at Children's Minnesota. Welcome, Dr. Ndely. Also joining us is the family of the hour. We have Charles Nixon, Kirstin Nixon, Caleb Nixon, and Raphael and Judah Nixon. Also, welcome, Nixon family. We are so honored to have you here and appreciate you guys taking the time to speak to us about your experience. So before we hear from all of you, I want our infection preventionist, Miss Adriene Thornton, to really help set the scene. We know that COVID-19 is real. We know that it disproportionately impacts people who look like us. But Adriene studies the data and focuses on making sure that we can prevent the contraction and spread of COVID-19. So Adriene, what is the data telling us? And should we be concerned about a second wave? Because what I'm seeing in the news looks crazy right now. What's going on?
Right. So, it depends on where you live. I am going to once again share my screen because it's really hard to talk about the data if people can't see it. And so I will go through these as quickly as I can so that I don't take up too much time, but I do want people to be well aware of what the data is looking like. So here we have, I'll start at the top for the U.S. for over 3 million cases with over 130 deaths, and that's a lot. I like this map because this map illustrates how bad it is throughout the United States. And so all of these states that are in the very dark blue have over 40,000 cases in their state population. This is a map that I look at from Johns Hopkins. I love this for our listeners. If you have children, or even if you don't have children, but especially for children, this is a fun map because it's very interactive. And so if you click on any of these little dots on here, the red ones or the yellow ones, it will go to those states and those cities and give you the actual data. And there are lots of other screens that you can play with on this screen. So if you look at the Johns Hopkins map, Minnesota doesn't look as bad because compared to other states, especially our hot spots of Florida, Texas, and California, we are not seeing as many new cases as they are. Again, from a U.S. standpoint, something that we already know is that our Black and Brown friends and family are heavily impacted by this COVID pandemic that continues nationally as well as locally. And so looking at the data from a weekly basis, and this data is as of July 9th, we have tested over 700,000 people with 40,000 positive cases. As of today, we're at about 43,000. We have about 4,000 hospitalizations, and about a third of those are ICU, and then about 1,500 deaths. That is the news. Looking at it from an age standpoint, again, the majority of the cases are in our middle-aged younger people. The younger 20 to 29 continue to be a concern because they are not as concerned, but the highest rate of death are in our oldest citizens. And so this is why it's really important for these graduation parties and, pool parties to make sure that if you're going to have them, that we're social distancing, wearing our masks, because this age group is the age that is passing it on to our older citizens, and they are the ones who are dying from it. Looking at our lab tests, I wanted to point this out because people keep saying, oh, well, we're testing more, so that's why we're seeing more cases. That is not necessarily true. You will have a slight increase in cases when you do more testing. But if you look at the last few weeks, we have constantly increased the number of tests that we've done. But if you look at the number of positive cases, we have not had a consistent increase. We've actually had a decrease in cases by week compared to how much we're testing. And so for the myth that people are spreading that we're testing more, that's why we're seeing more, not necessarily the case. I'm looking at hospitalizations and deaths. Our hospitalizations have kind of leveled off, as have our ICU admissions. And then our deaths, they haven't gone down a lot, but they haven't gone up as much as you would think based on the number of cases we're seeing nationwide. And again, this is our state data, so our state is doing much better than other states like Texas and Florida and California, and so that's why the rates are so low. And then looking at it by gender, not much has changed there. Most of the cases are spread half and half between men and women until you get to the ICUs, and we're seeing more men in the ICUs. And then again, looking at it by race, nothing's changed, more deaths in our white population, but in terms of cases and deaths and the spread per percentage of our population, when the Black people are only 7% of the population, but we still have 21% of the cases that continues to be a concern, and especially for our Asian and our Native Hawaiian, they are less than 1%, but for some reason they still account for a fair number of cases. Looking at it, when we adjust the rate, and we talked about this last week, that if all of the ages were spread evenly through each race, looking at the burden of disease on each of the different categories, this is a stark contrast, the graph we just looked at. Remember, we account for 7% of the population in Minnesota, Black people, but we account for over 2,000 of the cases, and that's 2,000 per 100,000 people in our population. So just to make it simpler for everybody, the highest burden of disease is on these three tall bars right here. And these are the categories that have the fewer percentage of case of population in the state. This right here is a concern because white people make up about 83% of the population, yet they have a very small burden of disease in the state. And then looking at it by hospitalizations, ICUs, and deaths, again, our bar is really high, as is the Asian, as is the American Indian, but we account for a small amount of the population in Minnesota, so that is a concern. And I'm going to zoom through these just because I don't want to take too much time, but again, if you're looking at the unemployment rates, we're seeing higher rates in the American Indian, Black, and Asian, as well as the multiple races, that could be spread out among any of those. And then what are the different worker characteristics? We haven't spoken about that, but one of the reasons that our brown and Black neighbors are impacted so heavily is because Black people make up about 11% of the essential workers, and our Latinx workers make up about 5%. In both of those populations, they're unable to work from home. And then for Black workers, there's a high engagement in healthcare, which means a lot of us work in healthcare, which makes us essential. And then for the Latinx, a lot of them work in the food industry, and we've all heard about the big outbreaks in the different meat packing plants and such. And so that helps explain as well why we are so heavily impacted by this pandemic. I wanted to share this graphic just because this really supports what we're telling you to do. This is a report that came out from the CDC, and there were 2 hairdressers in Missouri that worked while they were symptomatic for COVID. They both tested positive for COVID at day 6 and day 8 of their infection. They had worked with 139 clients during that time. None of those clients got COVID as a result of being around those two hairdressers. And that is because everyone was wearing a mask for the entirety, or at least the majority of the time when they were doing their hair and having their services done. So this just shows that face coverings do work when we do it properly. And so just want to make sure that we are clear about what our responsibility is as U.S. citizens. It is to wear face coverings when you're outside of your house, clean your hands often, don't touch your face at any time. If you do, immediately do hand hygiene. And as we're doing these grad parties, because no matter how many times we say, oh, we shouldn't be doing these, people are going to do them. If you're going to do them, make sure that you set them up so that you can maintain your social distance, and everyone should keep on their face coverings. Pictures without them are really good until the picture is of you in the hospital in an ICU bed. And just want to share these graphics again. This is the proper way to wear your face covering. And if you don't know what 6 feet of distance is, it is 1 hospital bed, 3 wheelchairs, about 3 stethoscopes, 2 really big dogs, or 2 or 3 people. And then here's where you can get tested. People are still asking about getting tested. The Minnesota Department of Health, if you go to their website, they have multiple locations listed here by county. So you can find those. And NorthPoint Health and Wellness as well, or they will do it by appointment if you call this number. So make sure you reach out to our local neighbors to get tested. And I think I did that all in about 15 minutes.
Yes, that was excellent. Thank you. Thank you for that. We really appreciate it. It's incredibly important that we get grounded in what exactly is happening, what is the data showing, because it's really easy to get complacent, especially as you start getting invited to the barbecues and the graduations, family functions. And also, like you said, so many of us are essential workers, right? So many of our family members. So for some of us, life hasn't changed too much because we're still going and clocking in every day, right? But we do have a responsibility to make sure that we are still practicing social distancing, wearing our mask. And you killed me when you said not wearing a mask and taking a picture is cute until your picture is in the hospital. Is that what you said?
That is exactly. Yes.
I felt it because I definitely took my mask off to take some pictures, but I'm not going to do that anymore.
Don't.
Of you.
we just had a report of a 30-year-old, and I forgot which state it was in, but a friend got COVID. They decided to have a COVID party to see if anybody would get it. And this 30-year-old got COVID and then died. So this is serious. And, she told her nurses before she died, I think I made a mistake. I thought this was a hoax, and it is not a hoax, people. You can still get COVID. And so, this is our new normal, is wearing face coverings wherever we go. And that's a message I really want people to take away, is this is our new normal for now. It may change later, but for now, you have to cover your face when you are out in public, because if you don't, you run the risk of getting COVID, and you don't know how it's going to turn out. It's not just the elderly that are getting sick and dying. It's not just people with underlying diseases. The 30-year-old was healthy, had no underlying disease, nothing, just a healthy 30-year-old contracted COVID at the party and died. So it is serious. And so take your cute pictures from a distance without your mask if you want to take your mask off.
I mean, at this point, I don't even want no pictures. I just want to stay alive. That's all I want. No. I just want to keep living.
Yeah.
So, wow. She said a COVID party. I have never heard of such, but I want to encourage everyone viewing to not accept that invitation. I want to really quick welcome another panelist who has joined us. We have Ms. Carla Lucas here, who is a nursing supervisor at NorthPoint Health and Wellness Center. Welcome, Carla. We're super excited to have you here. Ms. Thornton mentioned in her presentation that elders are some of the most vulnerable people when it comes to COVID-19, and some of the people who tend to pass away the most after contracting the virus. Can you speak to what elder care could look like, Ms. Lucas, when we're in a pandemic, because some people aren't allowed into senior facilities anymore, but the elders in our lives may have needs. So how do we provide care for our elders without putting them in harm's way. Oh, I think you're still on mute.
Sorry.
There we go.
I guess I can speak firsthand to that. You know, my mother-in-law is actually in a nursing home, and just to be able to kind of go visit her, you know, you have to be behind the glass. So it's a very difficult time for families now in the event of the COVID pandemic. And just, you know, to be an elder, you know, just, you know, being able to be home, and already it's an isolative opportunity to be, you know, an elder at home and be able to care for yourself. So at these times, you just have to make sure that you're aware and that you're, you know, helping the elders and being able to be in close contact with them and be able to provide for them, calling them on the phone and seeing what their needs are. You did speak a lot about make sure that you're protecting yourself. The elders are the most at risk, you know, and I think that we all know that 8 or 10 out of the deaths that we're seeing is definitely from our elders. So they're most at risk, being that they're die because they have not because of their age, also because they have, you know, severe illnesses, and then they're just most fragile. But we just definitely have to call and just make sure that they, whatever their needs that they have, that we're providing them, just shopping, because we really don't want them out in the community, you know. So calling just to making sure that whatever they may need, that we're providing for them, you know, and just simply being able to leave that on the doorstep for them, and just making sure that we are just being aware of what their needs are.
Thank you. Yes, that's super important, you know, making sure that we can still run the errands and do the things. But would you say, can we hug them? Like, what are the limits on, if I wear a mask, can I hug my grandma? What does this look like in practice? Like, what is pandemic practices with your meemaw look like? How do we do this?
You know, I just think that there's really no 100% understanding of how COVID transmission is happening. You know, we do have what we call PPE, but I think just being able to keep your social distances is the best way to prevent COVID. So I think that throwing your kisses, you know, communicating, calling is the best opportunity. I think right now, loving from a distance is the best opportunity. And hugging. We know that the virus is being passed from person to person. So I think when we make contact with people, we're putting people at greater risk. So I think that now is not a good time to hug and kiss and love on grandma. We have to love from a distance. And, you know, I see people doing parades by homes. I've seen people outside on the sidewalk having birthday, singing happy birthday to grandma. So I think right now we just get into the practice of loving from a distance is kind of the common practice as of today during the pandemic.
Got it. And I want to ask Dr. Simon and Ndely, you're a pediatrician, so you're working with the opposite side of our population, our babies, our young people. What is it like when a young person contracts COVID? I know with expecting mothers, when they go into the hospital, a lot of them aren't allowed to bring in even their partner with them for their visits. With a young person, though, are parents having to send their children in by themselves, or is it one parent? What does that look like?
Yeah, that's a great question. So yeah, I'm a pediatric resident. I work within the Children's Minnesota system. I also work at Masonic Children's Hospital, which is the children's hospital on the University of Minnesota campus, and I work over at Hennepin County Medical Center as well too. So I have some experience with COVID from a few different healthcare systems. Generally, similarly between that in regards to your question, you know, we do need to have a parent there in general, because that's the medical decision maker of the person and the kid. And honestly, with parents being there, their support is a part of our treatment plan and our care plan for our pediatric patients. So that's something that we identify that we know is important for the patient, the family member, as well as just for the overall care. as we continue to learn more about the virus, as we continue to learn more about best practices within the healthcare system in order to make sure everybody's protected, certain things develop and evolve over time. Initially, when this started, we had only one parent, and it had to be a parent or a designated caregiver that was in the room with a patient at any given time. And that's regardless if you're coming in with COVID or not. And that's just to mostly limit how many people are in the hospital at a given time. If a patient was under review for COVID or had contracted COVID, one of the other recommendations from most of the hospitals was that the parent had to stay in the room throughout the remainder of their stay. So couldn't necessarily switch out between father and mother at given times and certain things like that, that parent had to stay in the room. And that was for protection for those kids as well as everybody around, the people that they're interacting with, security guards, certain things like that. So right now, that's still somewhat kind of where it is. In certain systems, we are allowing both parents to be in the hospital at the time. Parents are, everybody's instructed to wear masks, regardless if you're a patient or not. In the room, the parents can take off the mask, but when a provider or somebody comes in, everybody is wearing a mask at the same time too. So there is a little bit more support system that can be involved in care. Even on the adult side too, certain hospitals are opening up to have visitation now, which is a good thing in its own right. Like Hennepin County, as an example, I think has visitation from rather, I think 10 to 8 or 12 to 8 during the day for patients that are in the hospital. I'm not sure about the ICU, but I think at least for the floor. That might be different for specifically COVID positive patients, but other patients are able to have at least one family member or something like that there too. And again, it's difficult because we are going with the virus as this is coming to get more prevalent. We are learning more and we are adjusting and adjusting and adjusting. So just as difficult it is for the public to be able to see what is like the best, recommendation or way forward, it is also different for the healthcare system because usually we would have more time to be able to test the virus, see how it's in a certain population before, so that we can prepare for the whole entire world when something like this happens. But as we go through the pandemic, at first start, we try to recommend the most general thing that can protect the most people. And then as we learn more information, we can update those recommendations as best as possible. One of the things that we've definitely known is very, very effective is the face mask, as we've been saying consistently, because we've, from certain studies that have been done, the most effective way to transmit the virus is by respiratory droplets. And so that's even from sneezing, from coughing for sure, but even that's from breathing, talking, all those types of things, you're still expelling some respiratory droplets. Every time that, you open your mouth or you breathe through your nose. And so being able to have that protection there significantly limits how much droplets are actually being expelled to your fellow citizen. So that's the biggest and most important recommendations when moving forward. Definitely with keeping up with hygiene is also important. We have shown that certain surfaces may not have as much transmission in terms of the virus. However, all these acts can definitely significantly limit the concern for spreading.
Thank you. So we have a question from the audience. Sandra wants to know, what do you think about kids going back to school?
Yeah, it's a difficult question. I think the most thing for me right now is their safety. For one aspect, it definitely depends on the school system, and I'm not going to be a public health specialist to be able to speak on what is the proper way to be able to open it or not. The one part that I can speak on is that I know that there are more cases of kids that are getting sick. There are more cases of kids that are actually being admitted into the hospital. So that's one thing I can for sure say. The disease process seems to be different than it is in adults. Honestly, the times where kids kind of get affected the most seems to be post-infectious. So there's kind of an infectious period of time where you would have that, that rapid test that comes back positive, and then you see a lot of the adults getting admitted to the hospital. Seems like that period of time, kids don't necessarily have as significant symptoms, but then maybe a week or two later after catching the virus, they start to have daily fevers and rashes and all sorts of things, and coming in with inflammatory markers, which is just basically saying their body is reacting to something, and just overall not feeling well. Some of those kids have been brought into the intensive care unit. I have not seen any deaths in any of our systems, at least from my experience. And their length of stay hasn't been prolonged within the ICU, at least. And at least from my experience when I was in the ICU last month, nobody had needed ventilator support in regards to this. However, the key point of kids coming in more sick with specifically directly related to COVID has increased over time. And we know in those particular areas where, you're congregating a lot of people, that provides higher risk of infection. With those higher risks, you have kids, you have kindergartners who will do the best they can, but if they're playing around with their friends, the face mask feels itchy or something of that sort, and then if they pass on the virus, that's an easy way for it to spread. So it is an extreme risk, in my opinion, to be able to just kind of blatantly, and just objectively send everybody back to school. I'm not sure what necessarily the best process is at this point in time, but I would be actually significantly concerned, especially with the hotspot areas where things are increasing more. Some of those larger school systems with 3,000 kids that attend the school, those just don't seem like very realistic situations to not create a hotspot. I know different school systems are trying to figure out maybe half the week. Some kids go a few days and then are off the other days. And so there's a lot of different ideas that are going around. But this spread is real. We keep on talking about the second wave, but we are still well into our first wave right now that has not really slowed down. So this whole second wave thing is just to me, it looks like this first wave just going to be exacerbated as respiratory in the fall and the winter comes on, and that's the biggest time where things are passed and people get sick, and we don't know how some of those normally winter infections that we know will happen will maybe potentially even make the symptoms of COVID worse or something of that sort too. So all those things are remain to be seen.
Thank you. I think all parents are, regardless of whether you can say yay or nay, it's helpful to hear from someone who sees it and who works with young people. So we appreciate that. And speaking of young people, I want to pivot to the Nixon family right now. You all contracted COVID-19 at some point. Can you tell us, how did it happen and when did you know that the entire family had contracted it?
Well, my father was diagnosed on May 4th, and then we were then my husband and my mother and I were tested first because we just figured maybe the kids didn't have it, whatever. And then we found out that following Saturday. He was tested on a Monday, we found out on Saturday after being tested on Wednesday that we also had it. And we also started having symptoms in between Wednesday and that Saturday. My mother did not have any symptoms, like physical symptoms, but she did have some COVID delirium, things that came up. And then after that next Monday, we had the kids tested and they were all positive too.
So what goes through your head as a mother or as a daughter? Your parents have it, you have it, your kids have it. What was that like for you?
It was tough. I was afraid. I feel like, because I have underlying issues, I have prediabetes, and I just wanted everybody to be safe. One of our kids Raphael has asthma, so I worried about him. And of course, I worried about my parents most of all, because of their age. They're 86 and 87 years old, and I wanted them to be okay. So
I can only imagine how terrifying that is as a parent, but I'm curious for your kids also. So I want to ask Raphael and Judah, who are twins, they're 13, correct?
Mm-hmm. Yeah.
So I want to hear from them. What was that like? Did you guys have symptoms? Did you think you were sick? When your parents said that you had to get tested, were you like, this is stupid, I don't want to do it? What was the experience like for you?
I did not want to get tested because having the thing shoved up my nose did not seem like a fun thing to do. And
I agree.
I didn't have any symptoms at the time, so I felt like I was all right.
So you had no symptoms, but parents insisted. Okay, and are you Raphael or are you Judah?
I'm Judah.
You're Judah. Okay, Raphael, what about you?
Speak up. I wanted to get tested to see if I had it or not, but I also didn't like the idea of getting a Q-tip shoved up my nose, but it was fine.
It was fine. It's not the end of the world, right?
Yeah.
Or is it terrible?
Yes. It wasn't terrible.
Okay, I think that's good to know, because a lot of people have a very real fear of getting tested for COVID because all they've seen is a giant Q-tip going up your nose, and it doesn't look like a whole lot of fun. But I think if you guys got it, that's important to note that it's not the end of the world, right? And that you can be positive even if you don't have symptoms. So did you ever get symptoms? Either of you?
I got a headache, that's all, and low-grade fever.
Yeah, low-grade fever, but nothing over like 100. So we just kind of all laid low.
Well, they did.
Yeah.
They, one of our, Caleb lost his sense of taste, or smell rather. And they had low-grade fevers for them. So they were very minor in the COVID for them.
Interesting. So did anyone have really severe symptoms?
Kirstin and I did. We had high fevers, the body aches, the cough, loss of appetite,
lots of mucus.
Yeah, it was nothing
fatigue,
nice.
We thought we'd feel better one day, and then the next minute we would be knocked down with lots of fatigue. Just washing your hair was really hard to do. So.
And it would jump. One of the worst parts about it is you'd feel fine, almost like you were through it, and then all of a sudden your temperature would go right back up to 100 or 101, and just the aches of that, it would knock you down. It would make you not want to do anything at all, and it was that was probably the worst part of it, because you just couldn't get through that. You would feel great, and then all of a sudden it would remind you that it was still there and take you right back to square one again.
So what's the timeline, would you say? How long were you all sick?
12 to 14 days, but I would say that's like the 14th day, I would say our fevers ended. So that's, we had 3 days in a row, those last 3 days, where we didn't have fevers. But then I would say even now I still have cough and mucus that comes up. It may be allergies. I've talked to my doctor about it, but he says also it could be just leftover stuff from COVID. Who knows? You know what I mean? It's not something that I've had before that's lingered like this. So.
Got it. Now, Caleb, you're 17. What grade are you in?
I'm a senior now. in
You're
high school.
going into your senior year.
Yes.
Okay, so now that you have made it through COVID, your entire family has, how do you feel about what should happen in the fall? Are you looking forward to going to school and being actually in school? Because it's your senior year, and also you saw your parents really sick. What's your opinion on what should happen?
I would like to go back to school because I prefer to see people in person when I'm learning different things. And I would like to see all my friends again, but I am worried about if I go back, the amount of danger I could be putting other people in, because I could catch COVID from somebody at school and bring it back here, and everybody could get sick again. Or I could take something from here, maybe if somebody from my house gets it, and then I could infect somebody else at my school. So really, I just want people to stay safe.
For sure, for sure. So in the event that we don't get to have a traditional school year for this upcoming fall, whether it's 100% virtual or a hybrid where there's some in person and some virtual stuff, as a senior, what's the most important thing to you this year? Is it prom, graduation, just spending time with your friends? Like, what is it that's really important for the people who are planning what school is going to look like for the fall? What's most important to you as a senior?
I guess just graduation.
That's valid. You deserve that. You absolutely deserve that. So I'm curious, as a family, you all find out over the course of a week that you've all contracted COVID. Do you now have to call all your other family and friends and let them know that you've contracted it? Like, what did you have to have some conversations with people who may have also been exposed? What was once you realized that the family had it, what did you do next?
Well, I think that we had kept pretty much to ourselves. We did tell a couple of our neighbors that we might have, social distanced with, like just across the fence or whatever, as they came by. But at that time, we were keeping to ourselves, except for going to my parents' home, because they had other health issues that I felt compelled to check in on them. Sometimes I wore a mask, and then sometimes dealing with stuff physically, I got hot and ended up taking my mask off. And those are the kind of things that I regret now doing, but we did have to call people and let them know. And, or my brothers too. My brother, of course, went over to help them as well and bring groceries and that kind of thing. So he as well got tested. So, but it wasn't a big circle of people that we had to notify. Charles had to notify his work. Yeah.
I'm an assistant principal at a middle school. So as an essential worker, I was still going in and coming back. But beyond that, we were really trying to be very conscious about practicing social distancing and not being too close to people. But one of the things is that we were still behaving normally. I would still stop by the store, and at this point it was still early, and I hadn't bought into the common sense of wearing a mask. So I'd wear it sometimes in, sometimes out. I know one of the questions I was asked was about, do I feel ashamed, guilty, or something like that about doing this? I don't, but I just feel that I didn't go overboard in practicing all the precautions that I should have. So, how we got exposed or when we got exposed, I don't know the answer to that too, but I just know now my thought process is so different because I don't go in any place, any store, anything without mask on. Sometimes I take my gloves with me. And it's just totally different the way I approach things.
And sanitizing hands when you get in the car and
Yep.
Wiping down steering wheels, all kinds of stuff. So, it's a lot. It's a lot, but it's necessary. It's so necessary.
It is necessary. And I know, especially here in the Twin Cities, a lot of people have found it necessary to leave their homes, not just to go to the grocery store, but to protest. And one of the questions from our audience was from Mr. Ernest Comer, who wanted to know is it still safe and appropriate to protest? Adriene, what are your thoughts on that?
So, you know, the Minnesota Department of Health set up several pop-up testing sites for 3 weeks, 2 days each week, to try and capture all of the people who were involved in the original protest and some of the public service events that were going on. And the good news is that we tested several thousand people, but only about 2% tested positive for COVID. So what that means is that being out in an open space, so outside, where you don't have air being recirculated in a small space like you would in a room, it helps. Wearing your face covering helps and works. We know that if everyone's face is covered with something, COVID will not be transmitted from person to person. So you can still safely engage in those activities as long as you are covering your face. If you're protesting, social distancing is a little bit more difficult, but, you know, don't touch each other, no holding of hands, still making sure you're cleaning your hands frequently, and maintain as much distance as you can. But the most important thing is making sure that your face is covered at all times. That's the one thing that you can do to protect yourself.
I just want to chime in on this 1 second too, with great respect to what Adriene just said too. Having had COVID and gone through it, the last thing I wanted to do was put myself in a situation with a large group of people in any kind of crowd. You know, I respect the protests and I support them, but there was no way in the world I was going to go down there, whether I had a mask on or not, and put myself, because, and here's the thing that I still struggle with nowadays too. People still do not believe that this is a bad disease. Too many people still think this is just like a flu or a cold. Yeah. And they don't understand that. I walk around, I go places, and I still see people not wearing masks, not social distancing. We did go to one event at the George Floyd Memorial, and we were trying to be cautious about it too, but one of my good friends who I hadn't seen in a long time decided he wasn't going to worry about it. He just came up and hugged me. And literally it scared me because this disease is relentless, and it's just nasty. And the idea of being in a place where there are bunches of people gathering together like that, it's just scary, and it's too big of a risk. And to going back to the question that was asked to Dr. Simon about school opening, as an administrator, I have a school of over 900 kids, and we are, as I'm on this thing, we're discussing what we're going to do in the fall. I don't see any safe way of bringing kids back to school in the fall, back in that building. I'm at a middle school, and I keep trying to think, well, if we cut it in half and only brought 400 back, no, they're still going to be all over each other. If we only brought 200 back, then we have to look at that. Well, what size the classroom is going to be? How are we going to feed them? How are we going to get them to school on the buses? Because you can only put 10 kids on a bus now, and you got 80 kids that ride a bus. It's you know, the sad thing is politics, I think, are driving too many of these decisions on this thing, and common sense is not. And we need to look at the reality of it, that this disease, this virus drives everything, and we need to use the science and listen to the science and make the right decision for our kids. I think, you know, putting school back into January or something like that after we see what's going on, and social distancing is a much better way to go, and just avoiding large crowds whenever.
Yeah. And, you know, to your point about people thinking this is just like the flu, they're very different. They are very different, and they're different in a couple of different ways. The flu, we know a lot about. When it first came in the 1800s, it killed a lot of people, just like the COVID is. We know a lot about it. We have a vaccine for it. We have a cure. We have treatments for flu. If somebody comes into our intensive care unit and they have a really bad flu, we have medication that we can treat them with. We don't have that for COVID-19. We are still learning about it. They are working on the vaccine. We don't know the long-term impacts of COVID-19. We don't know if you will, in a few years, develop some type of respiratory disease that you can't recover from. And so that is what makes it really different from influenza, that we don't know about it. We don't know what's going to happen with it. We're still learning how to treat it. We know how to treat it somewhat, but if you look at the list of symptoms, it has grown and changed from February to now. So we are continuing to learn about this disease, how it functions, what it does, how it impacts people. With flu, the biggest difference is we know a lot about it. We know what to expect. We can predict what flu strains are going to be circulating in the community. We can't do that with this strain of coronavirus. And that is where it's the biggest difference. So I really need people to stop comparing it to influenza. Stop saying that it's just like the flu, because it is not. It is much worse than the flu. If you get sick with it, it is harder to recover from, and we don't know what the long-term impacts will be.
Yes, thank you, both of you, for sharing that. I think that's incredibly important, is because a lot of people have minimized it and said, oh, I survived the flu, I'll be fine, but this really is something different. I want to hear from Raphael and Judah again. What do you guys think about going back to school? If you had the choice, would you want to go back to school after having had COVID?
I think if I knew I couldn't be affected by it again, and I couldn't spread it or anything like that, I'd want to go back to school, because being there, because when you're learning, your teachers can't really show you how to do things online like they can in the classroom. So I'd like to be back in the classroom, but if it risks your safety, then no.
I would rather stay away from school if it means staying safe, because online learning, it's not the same as regular school. But it's still, you still learn things and you're still able to complete your assignments. That's just how I would do it.
And also kind of speaking from the pediatric side, I want to make sure it's clear, from a lot of our standpoints, we know how important school is to the overall health for a kid. Personal development and social development, all of those things and those aspects are very important, and can be highlighted through interactions over at school, and that education that they're definitely important. But again, as I agree with both Adriene and the Nixon family, we have to kind of weigh what are the risks and benefits at this period of time. Trying to do this short, actually be involved and push towards the same goal, we can make it a shorter period of time. Unfortunately, it doesn't seem like we're able to come to a cohesive agreement of how to be able to move forward, and understanding that this is a serious problem and a serious concern, to be able to protect everybody's health in these environments. And until we're able to do that, it's always going to continue to be in the question, is this going to be safer or not, for us to be able to move forward. And I'm hoping during the fall we can find some type of solutions that can provide alternatives to the no-day. We're going to be hit with a wave of infection season again in the winter, though, and that may change things for this spring. So we do got to be honest with ourselves about that. We do got to recognize that, and we do got to be prepared for that. I just want to make sure it's clear with how everybody's saying here, it is not because we don't want them to go to school. It is not because we don't want them to get involved. It is extremely important in the overall health of a child, but knowing how this is spread, knowing how things are going on, and agreeing with Adriene, when we don't have information about a virus that we know is extremely contagious right now, and has a wide range of symptoms that affects different ages of people in a lot of different ways, it is putting a lot of people at risk. And we have to be able to be cognizant and be true to that, and see what we can do in the meantime while we continue to fight the virus.
Yeah, and I think we also have to understand that, there's more at stake here than just the children that are going to school. There are definitely adults that are in the classrooms, as far as the teachers that are there, that will definitely, the virus would impact them greater than the children. So, and have the teachers there that teach the kids, that would be more of a problem. So I just think that we just need to make sure that we look at the big picture. I do think that, when you mentioned that, we have to look at this from a public health perspective as relates to governmental decisions. I think you made a wonderful point there. So I just think that we need to look at the big picture when we make those decisions.
Absolutely. Thank you for naming that. Our educators are so undervalued, underpaid, and to ask them to put their lives on the line, they already sacrifice so much to make sure that our scholars are educated. And I do think we need to remember that there are other people. There are the administrators and, the people who clean the facilities. There's a lot more at risk, as well as the bus drivers. So it's definitely a conversation that we're going to continue to have. We actually have a virtual town hall coming up in the next few weeks that will be discussing in detail how reopenings are going to happen, if they do, what decisions are being considered, what alternatives are available, that type of thing. I do want to ask our young people while they're here, because I appreciate you guys being here. I appreciate you taking time to sit through this conversation. And after these next couple questions, if you want to head out, you're welcome to. You're also welcome to stay. But I'm curious, Caleb, Raphael, and Judah, did you talk to your friends about this? Like, what are young people saying about COVID? Because I know when we first learned about the virus, they were saying it primarily impacts elders. But here you are, 3 teenagers who all contracted it. So how do you talk to your friends about this?
So like my friends at school, I don't really talk to them a lot because I didn't get like any of their numbers or anything like that. But with my lacrosse team, we have practice, and a lot of the kids, they get it, but they can't really help themselves because they want to go over to you and talk to you and just like have fun. And like, you gotta realize you can't always do that. So yeah.
Caleb.
So with my friends, we try to social distance if we see each other. But like he said, it's kind of difficult when you want to just hang out and have fun. So when we talk about it, we try our best to just follow the safety protocol and all that, but yeah, we usually end up getting close to each other.
Steve? Oh, sorry, go ahead.
He said he's good.
Okay. I'm curious, do people in your age range feel like it's necessary to wear a mask, or is that just like not a cool thing to do?
Yeah, a lot of people on our lacrosse team, they'll probably start wearing more masks, I think, because like with us, since we had COVID, they like know it's a for sure thing now, I think, and that it's like just real and it can hurt you if you're not careful with it. So that's what I think.
Can I ask the young people a question?
Yes.
So, you know, we love young people and we have all this messaging, signs, posters, radio ads. What can we as a community, so the community being healthcare professionals, the Minnesota Department of Health, your friends, your neighbors, how can we tailor the messaging to really impact you and your friends about the importance of wearing the face coverings and social distancing? Because clearly we're not doing something right. Do we need to make TikTok videos about it to get their attention and get them to buy in? What do we need to do to get young people to hear us and listen to us and actually do what we're asking you all to do?
I think when you're talking about the messages that you send us to young people, you can really highlight what they can lose if they do get this virus. It's all about what they want to do right now, and they don't care about it because they just want to do what they want to do. But if you get this virus, you lose all of those things. So if you tell these people what they can lose and what will happen and what things they won't be able to do if they get this virus, that I hope could get through them better.
Okay.
One of the biggest issues that my wife and I struggled with is keeping our kids active and allowing them to do the stuff that they love to do, especially with our twins. They, as I said earlier, they play lacrosse. And it's one of the things that they love to do. They're on national teams and things like this. And the hardest part about it is when I take them to practices. When they started back, the practices were very well structured. They limited the amount of kids that could come into a place. They social distanced during the practice. There was no contact. There was nothing like that going on. But now, as they progress, now they're doing team practices. And this is the part that scares me because, I mean, it's a contact sport. They're running up against each other. They're hitting each other. I worry every time that they go out there, are they going to get contacted again? And this is one of those things that I say, you know, lacrosse being a mostly white sport, the dynamic of it is crazy because I really think white people don't get the fear that Black people have with this disease. And I've had conversations with people saying, you know, it hits my people harder than it hits yours. But yet they still don't wear masks. They still don't social distance like they should. And one of the biggest decisions we had lately, they had a tournament in Indiana, and I kept my kids out of it. Wouldn't send them go because of fear of the chaos that would be around there. And now my worry is that, you know, in 2 weeks, in 3 weeks, are we going to get a rash of kids on the team or parents coming down with this, and then are we going to be infected again? So it's crazy because I want my kids to have and do the stuff that they love to do, and I want to try to create a new normalcy that includes a lot of stuff too. But how do you do that and really sleep at night thinking that you're doing the best for your kids without keeping them shut down? That's the tough, scary part.
That's hard.
Mm-hmm.
Yeah. So to the boys, my follow-up question is, do you think young people would respond better or hear the message better coming from their peers? So for instance, if we made a commercial with the three of you in it, communicating to your friends and peers, do you think they would listen more? It would be more receptive? Or do you think that wouldn't make a difference?
It might make a difference, but the other thing is we're not like professional doctors or whatever, so
but your kids,
they could just like say, what does he know? And just like
say you experienced it.
Yeah. Just like skip the commercial or something.
What are you doing? Here's whatever you do, put it on YouTube, Snapchat, and Instagram.
TikTok.
Yeah.
And TikTok. Don't leave out TikTok. I love TikTok.
Those things. And if you could slip it into video games, do that too.
Yeah. That would be.
So then they'll see it.
Yeah.
That's all excellent ideas. And I think Adriene hit the nail on the head. There's got to be more that we have to do to be able to educate our young people and to let them know that this is not something, we had it wrong. This is not something that primarily impacts our senior community. This can impact anyone at any age. And so because of COVID, we are still sheltering in place, or at least as much as possible, right? So to Caleb, to Raphael, and to Judah, if we go on any sort of lockdown again, where people need to shelter in place and you have to spend an extended amount of time in the house, what can the adults in your life be doing to help make the experience while you're stuck in the house more enjoyable?
You could like start some kind of project or something, like do something that might take a while that you think would be really interesting
And interactive.
yeah.
I think, well, one of the things I like to do the most is play video games with my friends, and that's kind of the only way I get to talk to them. And I know I shouldn't be playing video games all day long, but it would like help if you would just like calm down a little bit with the rules, so I could maybe feel like I'm not just staying inside all day and playing with my friends and being able to play with my friends.
Caleb.
I'm good.
Thank you guys for participating. It's really helpful to hear your perspective, and I appreciate you being here. I know it's not the most interesting thing, but your voice really does matter in this conversation, and you're teaching us. I know you say you're not doctors yet, right? But you guys really are teaching us some things, so we appreciate it.
Yeah.
Sure.
And I will be calling on you guys because I'm going to I took notes of what you said, and I'm going to take that back to the children's communication team, as well as the communication team at the Minnesota Department of Health. And so we're going to have to start doing some more targeted communication efforts towards the youth. And so I am volunteering you now that we will be calling on you. Thank you for your help.
Thank you.
She said volunteering. That means you ain't got a choice. I see a question from the audience. Jamaica wants to know, this can be to any of our medical professionals, are there various ways to test for COVID? She said that she went to a center and she had to test herself with her children, but the swab, they didn't stick it really far up their nose, far enough for their eyes to water, but they said going really high into the nasal cavity is an older version of the test. So has the testing process evolved or changed at all?
It kind of depends on the institution. It depends on the institution, kind of what their lab has felt is the best, gives you the best results. Because one of the things that we keep on talking about is sensitivity, and that's just, is any lab, what is the quality of the lab to be able to pick up and make sure we get a positive result. What has been seen to get most of the box, at least initially, was getting back in the kind of in the nose. There are some tests where you swab in the nose. There are some oral tests, but it's not necessarily conclusive from at least what I've seen so far. If those can be more sensitive, or you have a higher likelihood of being able to make sure you get that positive result, if there is a positive result. That's why that initially, we usually with these viruses, the most where you can get the best sample of the virus is usually in that area at the back of the nose. And I think it just depends on kind of the lab with the testing that they have to be able to pick it up and certain things like that, which way is going to be best for them to be able to get the positive result, if it is going to be positive.
Yeah, it's interesting because my children's experience was very different from my wife and I. We went to a lab and literally they stuck that thing all the way up to the back of my brain. I was tearing for about 5 minutes and I could barely breathe. It was horrible. And then when I took those young people to get theirs, it's like they just came up and barely went in. And my kids were looking at me like, Dad, that wasn't that bad. Well, you were trying to. So yeah, they took it all the way up. So, Yeah.
I do also want to know why it may be a little bit different, because as you grow older, your anatomy changes. And so it might be the fact that how your nasal passageway is structured changes. And so when you're older, the way it's structured, that you may be able to get more of the virus from that way, versus when they're younger and it's not as developed, you can get more of the virus from the front. Again, I don't work in the lab, so I can't necessarily speak on that 100%, but generally I know with those kind of changes, sometimes that's kind of how it is, which is because I also got the really way back into my brain kind of test, and it was only for a few seconds, and it didn't hurt, but it didn't necessarily feel the most comfortable. But I think the ends 100% justify the means in terms of this particular process. And again, it depends on the lab. Some of the labs have more developed tests now where the nasal swab or even a swab of the mouth may be sufficient. So, but at the end of the day, being able to know, especially if you're developing symptoms or have a concern or those exposure, is much more beneficial towards your health right now than the couple of seconds of maybe a little bit of discomfort.
Now, is there a way that you can prepare for the test? Is it, okay, take a deep breath, close your eyes, don't look, hold your mom's hand? Like, is there, I'm seeing from the Nixon family that there's nothing you can do to make it better.
Yeah, I mean, maybe just if you could hold somebody's hand, it might help. But like Dr. Simon said, it's over pretty fast. It's just that initially when it's happening, and they went in both nostrils for us. So it was like the first one didn't seem that bad, but then the second one was really, really a lot.
Yeah.
So
now my wife talked about me when I got mine, because we were in the car and I got mine first. And so she's up there rubbing my brain, and I'm like, oh, my wife's like, stop making all that noise. Stop acting a silly thing. And she thought it was, so her first time, they were real light. And then when they shoved it up her nose the second time, they said, oh, okay, I know what you mean now.
But like we said, it is worth it. You need to know if you are positive or not. It was a lot, but it's worth it.
I only lost a few thousand brain cells, but it's okay.
Well, you had enough of them to be on this call, so all is not lost. You're still helping us. You're still informing us. We appreciate that. I want to hear from Ms. Carla Lucas. As an essential worker, as someone who's working directly with a population that is impacted by COVID, how does this impact your family? Because you're kind of at risk more than the everyday person. So are you worried about bringing it home?
Yeah, I don't know if I'm worried about bringing it home. I know my family is worried about me bringing it home. I feel that working within the clinic, although we get many people that have potential COVID coming into the clinic, I do think that we're the most protected from getting COVID with the amount of PPE that we are required to wear with patients coming into the clinic. I do choose to wear scrubs every day, so I don't have to wear my street clothes to work, and do wear PPE, as I mentioned, to protect me from getting the virus, and do wear my PPE in and out, and we do staff screenings coming in and out of the clinic also. I've developed a system for myself and to ease my family, is to make sure that when I do go home, to make sure that I go to the lower level, and I do have a basket where I'm able to kind of disrobe my clothes and keep my clothes in a separate area. I do shower in a separate location, and then redress in a separate location before I join the family, so that I am free, I would say virus free. And I do that for protection of myself, and also do the protection of my family. So I do feel pretty comfortable that way. I do. And I try to tell the staff here that, I think coming into the clinic, you're the most protective, because when you're out in the community, I do see a lot of people walking around the community, which still amazes me, that do not wear just a simple mask, even a simple cloth mask. which we do hand out at NorthPoint on an everyday basis. We have community masks that we do hand out because we do promote. We do agree with the Minnesota Department of Health that you do need to wear a mask wherever you go. If you're out in and about in the community, you do need to wear a face covering, so we do hand those out. So the system that I developed is just to make sure that I do separate myself, separate my clothing, to shower, and to redress into new clean clothing before I do join the family on a daily basis.
Thank you. Now you mentioned like washing your clothes and keeping them separate, but then do you wash your clothes with the rest of the family stuff, or do you keep it completely separate, even when cleaning it?
Yeah, I do wash my clothes with everyone else. I do feel that, you know, washing the clothes and then going into the dryer is proven to be safe once they do go through the laundry. But I don't store them all together. So I do have a separate laundry basket that I do keep them in until it's time to do the laundry. And then I do wash them all together at that time.
Got it, got it. Now this question can be for anyone. When we're providing for our families, we go out and we get groceries and we bring them into the house. And, you know, if some things are in a package, that's fine, but something like bananas or oranges or apples, we don't know if people have been touching them while they're in the grocery store. So how are we keeping ourselves safe by bringing in these other elements, essential elements like groceries into the house?
Mm-hmm. Well, you know, we recommend just as a standard of practice that people clean their fruits and vegetables before they eat them. There haven't been any studies yet that indicate that transmission is occurring from food. But again, the most important thing is for you to clean your hands. What we do know is that with any infection, the number one way you can prevent the spread of it is by making sure your hands are clean. And so if you touch the banana and you eat it and then you do hand hygiene, then once the banana goes in the trash, the banana peel, it is no longer a risk, but whatever is on your hand is. So if you do hand hygiene afterwards, now that risk has been diminished. And so more importantly than what do you do with the stuff is what do you do with your hands. If you're cleaning your hands often and in between touching things and using things, then that is the safest way to protect yourself. And if anybody hangs out with me, and I don't know if you guys have been paying attention, but I'm itchy today. And so my hands are in my face, but I've been using pieces of tissue. And I do this every time we do a town hall, and I'm sure nobody picked up on it, but I tear the tissue up beforehand, and then I take pieces of it so that when I'm scratching, I can take it, throw it away, and then I have a little bottle of hand sanitizer right here at my working space so that every time I do that, I can clean my hands. Now, mind you, no one's been in my house. We've been in quarantine forever, and I don't go out often, so it's not as if any of this is necessarily a risk, but I have to get in the habit of doing, I'm in the habit of doing it now. And so I keep hand sanitizer at my desk and on my nightstand by my bed. I have a bottle in my car and I have a bottle in my purse. And so even when I go to the grocery store, as I'm going in, I do hand hygiene. I wipe the cart down with the wipe, and then after I leave the grocery store and get in my car, I do hand hygiene again before I get in my car, because I don't want to touch the steering wheel and the gear shift with my hands that have been contaminated in the grocery store. And so just doing frequent hand hygiene really is the most important thing versus what should I touch and what should I not touch.
Got it. And what do you recommend in terms of what people should use to clean off their fruit? Is it just water or something else?
Well, you know, for killing organisms, you know, vinegar is wonderful. And I use a vinegar, a half and half vinegar and water mix just because I prefer that over the fruit cleaners that are in the store. You can use those products, but I don't know how they're made. And so I try to be as healthy as possible. And so, you know, just some hot water and a washcloth, because the friction from the washcloth will remove any organisms. Or you can just do a half and half vinegar solution. But the most important thing is that you're cleaning it before you eat it. And so, you know, you don't have to soak it in hot water, but just under some running water with some friction, you can get rid of just about any organisms that may be on your fruit. I wouldn't do that with grapes, though. I tried it and it did not end well. So just a little half and half vinegar and water is good for fruits like that. They're a little bit more sensitive.
Got it. Good to know. Now, this conversation is called COVID-19 in the Black family. And I happen to know just about every Black family has a section of their house where they keep all their plastic bags from the grocery store, right? So do we need to be disinfecting the bags as well? Like we're immunocompromised in my house. So my husband is like sanitizing the bags after he has taken the food out of them. Is he going overboard, or is that necessary? Because we do reuse the bags.
Right. I reuse the bags as well. I am not disinfecting them. However, after I put the new bags into the holder for the bag, I do hand hygiene. So yes, I have 2 stashes of plastic bags, but I have a dog, so I have a reason. But after I touch my stash, then I do hand hygiene. Because again, even if you disinfect the bag, if you don't clean your hands afterwards, anything that was on the bag may be on your hand.
And I also do want to note the virus has a lifespan, so it does die eventually. I think I haven't seen some recent studies. Depending on the surface of the substance or whatever that it's on, it could be a few minutes to a few hours or so. So I guess my point is, I think it is okay if you put the bags together. After a few hours, the virus is going to be dead regardless. So I don't know if you have to do every specific one, because you're not going to be using every single bag right after coming from the store. So, I appreciate all of the work that we are all doing to try to make sure that we're keeping ourselves safe. I also want us to be comfortable knowing that, we're still trying to live life and do things as best as possible. And, while we do that, and I think it is important, I don't want us to necessarily be freaking out about every single aspect of every part of life, because you have so many other things to worry about. You got your kids, you got your bills, and all those types of things that are also on your mind. So I love Adriene's point about, 2 things that we can do that are the easiest things: wear a mask, hand hygiene. That's the easiest things that you can do. And if you can continue to be as consistent with those as possible, you are really limiting the risk for you just in general. It doesn't even matter if it's coronavirus. It can be any infection. It can be influenza. It can be RSV. It could be anything. Those are just general practices to help against illnesses or viral illnesses. And if we can focus on those couple of things for ourselves and try to do that as best and as frequent as possible, I think you guys would be in good shape.
Excellent point. So this is COVID-19 and the Black family, and we wanted to take a moment to acknowledge that we have the families that are in our homes, and then we have our chosen families, right? Many of us on this call being a part of Black Greek letter organizations and other affinity groups. What can we be doing as leaders within the Black community, as survivors of COVID, as medical professionals, however it is that we identify? How can we be educating and empowering our extended family and the people that we love to make sure that they're practicing proper hand hygiene, mask wearing, practicing social distancing, that type of thing? And this can be for anyone.
Well, I always want to be a living example. So I actually have met with small groups of my sorority a couple of times to do some public service work, because our public service does not stop because of COVID. Okay. And, just making sure that I reiterate to them the importance of wearing a mask and social distancing, which, it's easy when you get together, you forget that, we're in the middle of a pandemic, and you get excited and you wanted to kind of be around each other. And that's fine as long as you're 6 feet away from me. And so people will notice that, for instance, I have volunteered, and it was Simon and I actually volunteered together at one of the food donation locations. And I ended up directing traffic because I felt like people were getting sick of me fussing at them about putting on their mask and social distancing while they were setting up the food donations. And, it's like I'm everybody's mom at that point. I don't care if I know you or not. If you're not doing what's best to protect yourself and others, then it is my responsibility to step up to the plate and remind you. And so I do that wherever I go, except in the grocery store, because people get mad. I just take my buggy and move away from those people. But just making sure that we hold each other accountable. because we are one big community and we're used to having others, you know, kind of hold us accountable for our behavior. We all grew up that way. You know, your next door neighbor may catch you doing something you're not supposed to be doing, and they will, you know, correct you and then tell your parents. And so this is no different. We have to hold each other accountable. We have to remind each other. And, you know, a lot of the information that I share here, I also share on my Facebook page, because I have so many Facebook friends and I want to make sure that everybody is getting the information they need. And since I'm reading this stuff and delving into it every day, it just makes sense for me to share it with everyone else, and then they can share it with their friends and family. And so just making sure that we take accountability for each other. This is not a time to, you know, take a couple of steps back and kind of let people live their lives. This is not the time to do that. We have to step up to the plate and be responsible for each other and accountable to each other. And so just making sure that we're doing that will go a long, long way to making sure that we all stay safe and that we are not transmitting COVID in the community.
I love that. And what organization are you a part of?
I am a Delta Sigma Theta Sorority Incorporated.
Lovely. I see your sorors
With
over here
Kirstin,
well.
yes.
and as a proud member of Alpha Phi Alpha Fraternity Incorporated, the oldest and greatest of all the fraternity and sororities, part of our motto is servants of all. And we take pride in networking the message of what needs to be done when we're going out in our community operations. We really have a big push on in the Black families of understanding the importance of wearing a mask, social distancing, and every time we go out, we are really spreading that message that this is what it looks like. We try to lead by example, and we really try to make people understand the importance of looking out for each other. Just like my wife's beautiful Sora said, you know, we have to get the message out, and we have to live it and breathe it every day.
Did you want to add anything to that, Kirstin?
I agree with everything that's been said. I mean, we just have to be out there. We have to let folks know that it is real, that we do need to practice wearing our mask and distancing and taking care of our hands and making sure that we're clean. We go over that often in my house, and it's like I even listen for how long people are washing their hands, and oftentimes they get upset with me, but I'm like, it's important. This is what's going to keep us safe. So I think that we just have to continue to put that message out there. One thing that I would also like to add when we talk about going back to school, I know this is not what we're talking about right now, but I do want to say for leaders that leaders in the community do really need to think about families that are not able to have the luxury of having their kids stay at home. And that I do know that school opening for some families is really important because parents need to go to work. And I just always wonder where can the push be with that? Well, how can we make this okay so that everybody can stay safe and not feel like you have to put your child in jeopardy because you have to go to work? And I didn't get to say that earlier, but I wanted to make sure I put it out there. As a social worker, I feel like if there are Black and brown children whose parents need to go to work and they're not taken care of, how as a society can we help them? And how can we make it okay? So I just wanted to say that.
Yes, thank you for that. That's incredibly important. It's absolutely a luxury to know that your kids can be homeschooling and be taken care of. And that's not everyone's reality. Not every scholar has accessible technology, Wi-Fi, or even just a safe home environment or an environment where they can get 3 meals a day and all the snacks that they want to eat, you know. So there definitely are multiple variables that come into play. And I think especially for us as a Black community and functioning as a Black family, if you do come from a household where you do have the privilege of, you know, you're able to be at home and the kids can learn virtually from your home, it might be a thing where we have to consider, do we welcome, you know, a neighbor into our home during the day so that they can learn there. Think about some other alternative ways to support folks who have a different home environment. Dr. Ndely, I feel like you wanted to say something next.
I mean, you were throwing out organizations, so I just wanted to name the best one, Phi Beta Sigma Fraternity Incorporated, because we are also out here. I think one of the biggest things that is helpful too in terms of our organization is just be able to kind of continue to spread the word of what is the best recommendations at the time too. I love what Adriene had noted about being an example, but then kind of spreading the word of what that example actually means, entails, and continuing to have a cohesive driving force amongst us all. You know, this is a trying time for all of us. And it doesn't matter if you're working inside the healthcare system, outside of the healthcare system, Black, white, Asian, it doesn't matter. You know, we are all going through this. It doesn't matter if you're American versus German or anything of that sort. You know, this has obviously been seen as a global pandemic, and a lot of people have been affected in a lot of ways, economically, you know, financially, emotionally, through their education. And so we are all experiencing this on multiple levels, and however we can continue to have a united force moving forward is going to be the best way for us to get out of this the quickest. And so that's what I'm hoping. That's what I'm continue to try to encourage, trying to encourage for us to try to keep it as simple as possible, and making sure you're wearing your face mask, making sure you're cleaning your hands, and also with school. And you know, it's important, and some other people are being affected more by not having in-person school, and trying to figure out what is going to be the safest way and what are contingencies for those families as well too. You know, what do daycares actually look like? You know, what are those things? All those things are things that we're going to need to continue to move forward on. But as long as we all recognize that this is something that we are all going through and how we can best do it together, I think will be the best way for us to get through it sooner. If we don't, it's just going to continue to take a while.
Absolutely. And I want to close with Ms. Carla Lucas. You're representing NorthPoint, and I know they do a lot of testing, and I'm curious, how accessible is it? What is still available? How can people make sure that they're taking care of themselves right now?
Yeah, right now we have 3 testing opportunities. We have what we call a walk-in clinic here, that's actually within our main clinic, and those for those that have symptoms that are severe enough that you need to see a doctor for. And all of these are by appointment only by calling 543-2500. We also have a drive-through clinic that's located at our 1256 Plymouth Avenue building. And that's a 5-minute appointment, and you just can stay in your car. And we do the nasal swab at all of these locations. And we'll be opening up a new location at 800 West Broadway, which is actually a walk-in clinic also. And that will be opening as of Monday, July 20th. So all of these are by appointment only. And we'll be running those as long as we have an opportunity to test people. Our goal is to make sure that we have complete access for the near north population. We know that the opportunity for testing has been limited in our community. So we want to make sure that we have an opportunity to test those individuals in our community. So we'll be doing that through as long as we have the pandemic available. So again, those appointments can be held by calling 612-543-2500.
Perfect, thank you. And I made a commitment that I would also lift up our brother James Burrows, who is representing Children's Minnesota, and he's a brother of Omega Psi Phi Fraternity Incorporated. He said, I had to let the people know that there was a cue behind this production, as well as we talk about the Black Greek family. And I, of course, am representing Zeta Phi Beta Sorority Incorporated. And one of the biggest things that I've learned, shout out to my brother, Dr. Ndely, one of the biggest things that I've learned from my sorors over this year as we celebrate 100 years is that things don't necessarily go according to plan. Sometimes you have to be willing to think about the greater good and scale things back or cancel things or make things virtually that were once going to be in person. It's not that we stop living, it's not that we stop serving, but it's that we do so in a responsible way. And so I want to thank you guys for listening. I want to thank all of our panelists for sharing your information. And we are going to be back here in 2 weeks for our next virtual town hall. That's going to be July 29th, same time, same place. And we're going to be discussing COVID-19 and gun violence, as we recognize that this pandemic has led to, and other community events, as well as the murder of George Floyd, has led to an uptick in community violence. And so we're going to be unpacking that. And we want to invite you guys to come back for the conversation. Before I go, I want to say a special thank you to ALF, as well as our partners at the Children's Minnesota, the Minnesota Spokesman Recorder, Minnesota Community Care, Insight News, and of course, our sponsors, the Minneapolis Foundation, NorthPoint Health and Wellness, and Children's Minnesota. So please make sure that you guys are all taking care, that you're making sure that you wear your mask and practice hand hygiene. Those are the two easiest things that we can do to protect our own family, and to remember that you don't necessarily have to have traditional symptoms to have contracted the virus. So it is imperative that if you've been exposed or weren't wearing a mask at some point, that you do go get tested. Thank you guys so much for watching, and we'll see you in 2 weeks. Take care.